Department of Public Health and Social Services Director James Gillen says that if it happens, sequestration will result in about a 13% cut to almost all of the services that public health provides. This includes programs like WIC, or the Women's, Infants, and Children's Program.
Probably the best way to provide nutrition to women and children because it prescribes what you can buy and very healthy foods. It will probably going to be cut by maybe 10 to 20%.
That means about a $900,000 to $1.8 million cut to the WIC program.
One of the most effective nutrition programs that's been around is going to suffer the most severe cuts. We have about 7,600 clients right now in WIC. The sequestration happens on March 1st. We're going to cut about 700 of those. And then we'll have to have waiting lists for anybody else who may qualify.
And WIC isn't the only important program sequestration will affect. Public Health's immunization program is also at risk. The cost of immunizing a child has increased 500% in the last 10 years, while federal funding has decreased over the last 10 years.
If we're committed to making sure that all of our children are immunized properly, we have to find the funds somewhere. And everybody's tight, everything is difficult. And in order to purchase vaccines, we're probably going to have to let people go.
Gillen says in addition to cutting back on personnel, they may also have to cut back on various other programs, including the maternal health, child health program, the family planning program, and the chronic disease program.
Our HIV, sexually transmitted disease programs are going to suffer some cuts, which means people get less treatment. Our outreach is not going to, case finding is going to suffer. I mean, and these are not scare stories. We're not trying to get people, to make sure we get more money. This is just what's going to happen if the sequestration happens. Well, that's what's going to happen. What the solutions are, I don't know. I'm not an economist. I'm not a money manager. I really don't know what the solutions are. But when you do things like this, we're talking about children here. We know what the value of immunization is. You don't immunize them, it's going to cost you more money in the long run. It just, the way across the board cuts just don't make any sense. They really don't.